Folks, some interesting facts and key points about gastritis that will help you in your future medical practice. So let's talk about myth and reality, and real politic, real medicine. So gastritis is more than just stomach ache. It's a complex condition with multiple causes, varying risks, and involving treatment strategies. So it's a constellation of the problems, if you want. It's not just a single condition, but a spectrum of gastric mucosal inflammation. And it can be acute, rapid onset due to, for example, the most common non-steroid anti-inflammatory drugs, some toxins, or severe stress. Yes. So, principal culprit, non-steroids and stress. Then chronic. Chronic means chronos, Greek word, Greek god of time, chronos. Chronic, slow progression with potential complication like atrophy and metaplasia. Key distinction. Acute gastritis usually resolves quickly, while chronic gastritis can lead to long-term damage and increased risks. Now about Helicobacter. Helicobacter pylori, sometimes pronounced, actually I think more correctly it's Pylori, like Helicobacter pylori. No, let it be pylori, Helicobacter pylori. So, my beloveds, it's one of it might be possible, but not the only culprit at all. So during the exams, of course, we have to set that we have to manage it with triple, even quadruple antibiotics, but real medicine, that real science, medical science, that Helicobacter pylori, Helicobacter pylori is one, and not for a big, actually it's a very weak, and not the only culprit at all. So yes, they say that Helicobacter is a major cause of chronic gastritis worldwide, but not at all. Every case of gastritis is due to the bacterium. Principle, I repeat it, it's non-steroid anti-inflammatory drugs. Doesn't matter. You have this Helicobacter or not. And I repeat it. It's very important to understand. That's why you have to ask this question about non-steroid drugs. Not just take antibiotics, prescribe antibiotics, like a nonsense thing. Non-steroid anti-inflammatory drugs and, of course, chronic emotional stress. Autoimmune gastritis destroy parietal cells leading to pernicious anemia. Bile reflux damages the gastric lining. We know that. So actually a very interesting fact, my beloveds, concerning Helicobacter pylori or pylori. Helicobacter can survive stomach acid by producing urease, you're up to know how to pronounce, which neutralize the acidic environment. Remember that. I repeat, now we know that. It's not widely known, unfortunately, but Helicobacter can survive stomach acid by producing urease, which neutralizes the acidic environment. So, Helicobacter can be a hero and a villain, if you want. While Helicobacter is infamous for causing ulcers and gastritis, research suggests that some strains may have highly protective effects. Highly effective protects gastro-in, for example, GERD, gastroesophageal reflux disease, by reducing acid secretion. Obesity-related metabolic disorders, potentially influencing hormonal regulation. So that's why it's nonsense, it's delirious to eliminate this Helicobacter. Then, remember that, not all chronic gastritis increased cancer risk. And Helicobacter is nothing to do with this. The risk of gastric cancer is linked only to certain types of chronic gastritis, so-called hypoacidic chronic gastritis. Hypoacidic chronic gastritis. Atrophic metaplasia, yes, high risk. Autoimmune gastritis, yes, high risk. Hyperacidic gastritis, hyperacidic, the most common types. Hyperacidic gastritis. No, I don't know. For example, Zolling-Garelison syndrome, no increased risk. So hyperacidic gastritis is not for cancer risk, period. Remember that. I don't know how you will pass on the big exams, but for your future medical job, remember that. Don't prescribe antibiotics for this. Clinical takeaway. Not every patient with gastritis is at high risk, at any risk for gastric cancer. So look for atrophy and acid secretion status. Remember that. About anemia. Gastritis can cause anemia, but not always the same type. So-called Helicobacter associated gastritis can lead to iron deficiency anemia due to poor absorption. But it's not a question of Helicobacter, it's a question of poor absorption. Okay? Autoimmune gastritis causes pernicious anemia. Pernicious anemia is a bad thing, very bad thing, by destroying parietal cells. Loss of intrinsic factor B12 deficiency. So actually for your exams, if patient has both iron and B12 deficiency, suspect autoimmune gastritis. Not only for exam, for your future medical job as well. Then symptoms can be surprisingly be mild or absent at all in absolutely vast majority of cases. Chronic gastritis is often asymptomatic, especially in early stages, decades. When present, symptoms can include epigastric pain, burning or gnawing, nausea, bloating, and early satiety. Vomiting or hematemesis in very rare severe cases. What is clinical insight? Many patients with chronic gastritis are diagnosed incidentally during checkup and endoscopy for another condition. Endoscopy is the gold standard for diagnosis. While non-invasive techniques, urea breath test, stool antigen test, can detect this Helicobacter, definitive diagnosis of gastritis requires, if you want, endoscopic biopsy. What to look for? Erythema and mucosal inflammation in acute gastritis, atrophy and interstitial metaplasia in chronic gastritis. Caution: don't diagnose gastritis based on only one symptom alone, only just Helicobacter. It's a myth. Many cases are silent. Helicobacter is nothing in this case. Or concerning this triple therapy for Helicobacter. That's old, very old news. Not all Helicobacter cases need a treatment. Some patients, 90% of patients, remain asymptomatic and may not benefit from your so-called eradication therapy. Don't kill patient with your triple, quadruple therapy and provoking dysbiosis symptom. NSAIDs. Induced gastritis can be prevented due to NSAIDs. And we know that NSAIDs, non-steroid anti-inflammatory drugs inhibits prostaglandin synthesis, which reduces mucus and bicarbonate production, making the stomach lining vulnerable to acid. Actually, concerning alcohol, the same. Not all alcohol and just alcohol provoke this gastritis. It's a myth. Concerning NSAIDs, yes. NSAIDs, non-steroid anti-inflammatory drugs, they're first major cause. Prevention strategies use PPIs, proton inhibitors, omeprazole, pantoprazole for high-risk patients. Concerning COX-2 inhibitors instead of traditional NSAIDs, it's highly controversial. Advise patients to take NSAIDs with food to reduce irritation, and actually said don't take these NSAIDs. For example, any NSAID for me, it's a high problem for me. Red flag. A patient on NSAIDs, non-steroid anti-inflammatory drugs, is presenting with epigastric pain or anemia. Always suspect NSAID-induced gastritis or peptic ulcer, and that's why we have anemia. Okay? Finally, diet and lifestyle matter, but there is not everything. While stress, NSAIDs don't directly cause stress don't directly cause gastritis, they can exacerbate symptoms. Avoid excessive caffeine, excessive alcohol. Stop smoking. Yes, I forgot about smoking. One of the most causes, smoking. Try to eat small, frequent meals to reduce discomfort and reduce processed foods that may and can trigger symptoms. Myth: spicy food or some alcohol causes ulcers. No, my beloveds. Reality: spicy foods or some types of alcohol may worsen symptoms, but they don't cause ulcer or gastritis unless the stomach lining is already compromised. Okay? And final takeaways. Gastritis is a broad term converting acute and chronic inflammation of the stomach lining. Helicobacter is a one possible but not the only, not at all, only cause of chronic gastritis. Cancer risks exist in hypoacidic atrophic gastritis cases. It's nothing with Helicobacter pylori. Pylori. New treatment guidelines, I suppose, will outdated this therapy, antibiotics, I suppose, I hope. And I repeat, not all Helicobacter strains are bad. Some may even protect effective against GERD, against even obesity, sometimes with supposed metabolic syndrome, etc., etc., etc. Okay? So it's not only these tips I give it to you, not only for exams, but your future medical practice as well. Don't forget to follow and subscribe not only my Dr. Y YouTube channel, but as well as my Dr. Y Telegram channel. It's a private channel, I know. So you find this Dr. Y, you tap in searching mode, Dr. Y Telegram. It's a private channel, it's a bot. Dr. Y, W-H-Y, like question, why? Dr. Y, it's me. So Dr. Y, you click start and choose your plan. God bless you.